In general, women's health has been sidelined. There are a lot of issues which are very specific to women, and most of the clinical trials and the research that has been done in medicine has not been gender specific. We are now understanding that women are genetically very different from men, and so they do need specialized care. They do need physicians who understand that women's health issues are different from men, and they cannot treat men and women with the same medical problem equally. One of the things that I've been fascinated as a family doctor is that, the number one cause of death in women is heart disease. Women worry about breast cancer, cervical cancer, and ovarian cancer, and those are, while they are important, heart disease is not only the number one killer. Even after diagnosis of, for example, a heart attack, if a woman has a heart attack, the studies have shown that women survival rate is a lot less than men. Until menopause, they are protected, but post-menopausal women is very important that they come and speak with their doctors, make sure that their blood pressure is checked, make sure that their cholesterol is checked. That is a time in a woman's life when they typically gain weight. Weight gain can affect their risks for diabetes and heart disease. The American Heart Association has what we call a risk calculator. Again, it's more not gender specific. It was evaluated for the population in general, but by scoring somebody's risk of heart disease, we can actually, if their cholesterol, even if it's not very high, we can start them on medications or advise them about dietary and lifestyle changes that can reverse heart disease. Even if they have already occlusions or blockages in their arteries, it can be changed or reversed with proper diet and lifestyle and medications. Bill Clinton had a triple bypass in New York, and after he had this bypass, he was told to cut down on his red meat consumption, and he became a vegetarian. 2 years later, when he had a heart catheterization, they found all his blockages were gone. So I always give patients his example that you don't have to be a vegetarian, but by being very careful about your red meat and saturated fat consumption, you can actually reverse heart disease. Well, the other thing I wanted to talk about is depression. Women are 9 times more likely than men to experience symptoms of depression. We know that, again, when women hit menopause, they are hitting the empty nest syndrome. Children are growing up and leaving home. They may have elderly parents to take care of, and they have their children to worry about. So a lot of studies show that women in their 50s, 60s, and 70s are probably the most stressed in the entire general population, and they experience more symptoms of anxiety and depression. While women are more likely to seek help than men are, we do know that there's a very high incidence of anxiety disorders and depression in women. And again, I tell my patients there are a lot of good therapies for these, whether it's counseling or whether it's medications. And we do know that having depression and anxiety is a risk factor of heart disease, risk factor for diabetes, risk factor for stroke. We do know that. So that's important for women to recognize and seek help for.